This is what the vaccine levels, I think you provided this showing that the levels have dropped down in the US. You want to comment on this? And what can we do about it?
Yeah, so a couple of things, as we were engaging, initially the vaccine rollout was obviously, it was a tiered approach because we just didn't have, it was a supply and demand issue, right? So we had to vaccinate the people who are most affected at first. And once we had enough supply and ramped up the supply of the vaccines, essentially everybody who could get a vaccine is offered a vaccine. That was great. And we started seeing, really great vaccination efforts, nationally, obviously some places better than others, but what did that do? That really drove the virus levels down across the nation, which was great. Hospitalizations went down, deaths went down, and we saw just a correlating, circumstance with that. And that was great. But what happened in turn is people sort of got a little complacent, where people started thinking that, oh, okay, the levels are so low, this is great, COVID is gone, and people say, okay, well, I don't need to get vaccinated now because, there's no more COVID. And unfortunately, that's not the reality. And with that map that you just showed, the fact that, so much of the world, majority of the world is not yet vaccinated, and most low-income countries and some middle-income countries won't even have access to vaccines till 2022, the earliest, if anything. That as long as this virus is out there and the transmission is there, it will have a chance to continue to mutate, and variants will emerge. And how do we protect ourselves from these emerging variants? And so, as you mentioned, we are privileged by living in this nation where we have adequate vaccines. It's not a supply issue. We don't have to do a lottery. We don't have to wait. We can just get a vaccine anytime. We have 24/7 vaccination sites. We've made it so easy. And there are even more, now there are incentives with it as well. And now we have data. We have so much data. Every day we have more and more data showing, how these vaccines are really well tolerated by millions of people. And, and we are seeing this in real time, and we should have comfort in that. We should also know that there is complete transparency in the process. I think that's the thing that I like to discuss most with people, is that, there's checks and balances in place. Obviously that has happened throughout the trials. There have been independent bodies that have reviewed all the data to make sure that the vaccines were in fact safe and effective. But we have the reporting system in place, as you mentioned before, that if I have a patient who has some symptoms after a vaccination, they can self-report it to the CDC, to VAERS, or tell me as a physician, and I can report it. And we need to have all of this information, because if there is a safety signal, if there is something like we had, those rare cases of the thrombotic events with Johnson & Johnson, that we know about it, and we know, and we can say, listen, we have options, we can put this warning on the vaccine, and say that, okay, if you're below the age of 50 and a female, you may be at risk of this rare potential side effect, and you have other options, but to have the transparency, I think, is the key in all of this, and to have faith in the system, that when there is a pause on the vaccines, it's not because, something is terribly wrong. It's to make sure that nothing is terribly wrong, and that, can we keep going forward, or do we have to make changes? I think that's the thing that I share with people frequently, is that everything is there and available for viewing on CDC. You can see how many people have been vaccinated. You can see the side effects that people are reporting. You can see exactly what's happening. And so I think, there is, faith. You can have faith in the system, in the sense that, everything is being reported and, and is being made available for public viewing.
I think that is so important, the faith in the system. And that's part of the problem. We have not been able to trust the system. People of color, both First Nations, Hispanic, and African Americans, and others, have not been able to trust the system, because the system is what has been turned against us time and time and time and time again. And so we need trusted messengers like you and me. And I remember that Dr. Anderson told us there's something like only 5% of the physicians in the US are African American. And that was the case in 1900, that's the case now. We have not moved, not one, maybe not 1900, maybe 1950, but we have not moved. So we've got to somehow be able to get away from the distrust, because it's rightfully placed in some cases.